Hi everyone, I am Javier Bernat coming from Bis and Topaz. And today's topic is the protozoa infection. For the one that assigned to me is a protozoa infection of the gastrointestinal tract, which is the Cryptosporidiosis, and the protozoa infection of the circulatory system, which is the Chagas disease and the malaria. First, we go to the protozoa infection of the gastrointestinal tract, which is the cryptopyrrhosis. Cryptopyrrhosis is a gastrointestinal infection caused by a congrual protozoa, maybe asymptomatic or maybe caused by diarrhea, cramping, and abdominal pain. The disease may be prolonged, permanent, and fatal in immunosuppressing patients. Children younger than 2 years of age, animal handler, traveler, homosexual, and daycare center worker are particularly likely to be infected. Outbreaks in daycare center are common. Outbreaks have also been associated with drinking water, recreational use water, and drinking unpasteurized apple cider contaminated with cattle feces. Next is the system involved is from the word gastrointestinal tract is from the digestive system. Then next is the pathogen. The pathogen of cryptopyrrhosis is resolved from ingestion of sites of Cryptosporidium palvum. Other congenial parasites of human are the general Psychopora, Isopora, and Psychrotices. The reservoir and mode of transmission of cryptopyrrhosis is the reservoir include the infected human, cattle, and other domestic animal, and the transmission include the fetal oral transmission, from person to person, from animal to person, or via ingestion of contaminated water or food. Silent symptom is the weight loss, fever, vomiting, nausea, dehydration, malaise, water diarrhea, stomach cramping, or pain, and the lastly is the anorexia. Next is the laboratory diagnosis. The cryptopyrrhosis can be diagnosed by microscopic observation of a small 4 to 6 ml diameter acid fast site in stain smear of fetal specimen. Sensitive and specific immunodiagnostic procedures are also available. The following tests can diagnose Cryptosporidium infection. Acid staining test to get cells from the analysis. Your doctor might ask for a stool sample or possibly take tissue sample or biopsy from your intestine. Kay coming mo siya sa intestine, di ko po siya dito sa intestine. The sample is then looked at under the microscopic available. Next is the patient care or the nursing consideration. First is keep the patient hydrated by maintaining IV potency and letting the patient drink more fluid para katong iyang infected is matai to niya. Next is emphasize the importance of proper hand washing. Kay maybe ang cause sa iyang disease, number 1 cause is bacteria. Nagikan na sa atong kamot, di kinahanglan is manghugas pagtarong. Around less than 30 seconds ang hand washing. Then, third is instruct patient to wash fresh fruit and vegetable before eating. Kaya na may tendency na kung di mo hugasan ang prutas or ang gulay kay naay kanang contaminated to kanang dapat hinluan jud siya labi na karon. Next is maintain standard precaution. That is a very important in sa tanang mga sakit na jud kay maintaining standard precaution. Next is we are now in the protozoa infection of the circulatory system, which is the Chagas disease and malaria. First is the Chagas disease. Chagas disease is American trypanosomiasis. Is also known as the Chagas disease, in honor of the Carlos Chagas, who described the entire life cycle of Trypanosoma cruzi in 1909. In the acute stage of disease, patient may present with an inflammatory response, at the site of the Redova bug bite. Manis siya ang katong mamaak, katong makakos sa Chagas disease, ang Rivodovi bug disease. Fever, malaise, lymphadenopathy, and hepatomegaly, enlarged liver. And splenomegaly is the enlarged spleen. Although it may be asthmatic, chronic, irreversible complication include heart damage, arrhythmias, enlarged esophagus or megaesophagus, and enlarged colon or megacolon. Life-threatening meningoencephalitis may be occur. Next is the system involved is the central nervous system. Kaya naman sa eyes, hindi maapektuhan dyan ang nerves. Pero sa circulation, maigo po ang blood. Involved in Chagas disease. As confirmed by pathological study, the fundamental histopathological findings associated with the acute nervous form of the disease is nuclear encephalitis in multiple foci. The pathogen is, as you look at the picture, man iyang pathogen sa katong Chagas disease. Man siya katong insect. The etiologic agent of American trypanosomiasis is T. cruzi. Man siya si T. cruzi, which occur in two stages. The first stage is what we call trypanosomiasis form, or known as hemoflagellate. And the second is a non-motylite or intracircular parasite, the amastigotic form. Next is the reservoir and mode of transmission. The reservoir include infected human and more than 100 species of domestic and wild animal. Gravistegia, including dogs, cats, carnivores, and primates. The vector of American trypanosomiasis are rather than large bugs, Manisidia. They are known by many names including Ridovi bugs, triatomy bugs, kissing bugs, and cone nose bugs. A bugs become infected when it take a blood melts from an affected animal. Nagikan siya sa animal na affected siya. Later, when the bugs takes a blood meal or feed at the person at the corner of the sleeping person eyes, the bugs defecate, malibang. The person become infected. Kung malibang siya sa imong eyes, di ma-affected jud ka. By rubbing the insect feces, imo siyang kuskuson. Next is which contain the parasite. Katong ihang tai, mauto siya na nag-contain og parasite, mauto siya nag-contain sa katong Chagas disease into the bite, wound, or eyes. Sa samad ba or sa mata? The characteristic unilateral swelling of the eyelid that occur after T. cruzi is rubbing into the eyes is called Romana sign. Kung makuha na to, ang tawag niya is Romana sign. Transplantation also occur. Next is the signs and the symptoms. Fatigue and syncope, shortness of breathing, palpitation, GI reflux, severe constipation, and difficulty. Next is the laboratory diagnosis. American trypanosomiasis is diagnosed by observation of trypanosomiasis in blood or amastogoty in tissue, especially cardiac tissue. The heart haglok siya or the lymph nodes biopsies. Immunodiagnostic procedure are also available. Xenodiagnosis is performed in endemic countries. In this procedure, sterilized or uninfected laboratory racing Ridovi bugs are allowed to take blood meals from persons suspected or having Chagas disease. The bite is painless. Ang kanang pagpaak is sakit daw kadyo, di makuan. Sakit pa sa sakit sa ngipon. sakit pas manganak. The bugs are then taken to a laboratory where their feces are periodically checked microscopically from the presence of the parasite. Yan. The next is the patient care and nursing consideration. First is emphasize the importance of proper hygiene or hand washing. Kay sa matabaya siya is imong ikot is imong kamot di kinahanglan jud limpyo pud para ang parasite is ma-reduce. First is maligo jud kanunay. Maintaining standard precaution. Sa tanang kwan is na jud na siya. Avoid patient contact to any destruction of the eyes like dust. Kung nakadalaad, i-avoid jud ang patient. O ang silingan adri, i-avoid jud niya ang patient na para makon ang dust. Next is we are now in malaria. Very common, very popular na sakit. It's a systemic Protozoal infection with malaise, fever, chills, swelling, headache, and nausea. The frequently with which the cycle of chills, fever, and swelling is repeatedly is referred to as periodicity, which depend on the particular species or malaria parasite that is causing the infection. The intermittent bouts of chills and fever are sometimes referred to as paroxysms. In addition to these symptoms, falciparum malaria may be accompanied by cough, diarrhea, respiratory distress, shock, renal and liver failure, pulmonary and cerebral edema, coma, and death. Makapatay si dyan na malaria kaya gikan siya sa lamok. Ang iyang system involved is the circulatory system kay naman siya sa katong dugo. Next is the pathogen. Human malaria is caused by 4 species in the genome Plasmodium. Plasmodium viva, the most common species. P. falciparum, the most deadly. Wow, deadly siya. Plasmodium malaria and Plasmodium ovale. These are intratrianocytic Protozoal parasites. Infection with P. viva and P. ovale result in chills and fever every 48 hours, and it is referred to as tertania malaria. P. malaria infection cause chills and fever every 72 hours. That is referred to as Quantan malaria. P. falciparum periodicity varies from 36 to 48 hours. Mixing infection. That is infection involving more than one Plasmodium species. Occur in the certain geographic areas. Drug resistance, strain of P. vivax and P. falciparum are common. Plasmodium spp have a complex life cycle involving the female Anopheles mosquito, the liver, and the erythrocytes or the blood of an infected human and many life cycle stage. Grabe siya. Next is the reservoir and mode of transmission. Infected human and infected mosquitoes serve as reservoir. Most human infections occur as a result of injection of spirozoites in the bloodstream by an infected female Anopheles mosquito, while taking a blood male infection may also occur as a result of blood transfusion or the use of blood-contaminated needles or strides. Next is the signs and symptoms. From the central sa atong O is na headache. Sa atong muscle is the fatigue and the pain. Sa systemic is the fever. Sa back is the pain. The skin is chills and sweating. Respiratory is dry cough. Sa spleen is enlargement. Stomach nausea and vomiting. Next is the laboratory diagnosis. Malaria is diagnosed by observation and identification of intracytic Plasmodium parasite in genome sa stained blood serum. Immunodiagnostic and molecular diagnostic procedure are being tested. Next is the patient care. First, improve body temperature by maintaining warm environment. Kinahanglan siya kanang ikon yung body temperature kay na masya hilanat. Second is maintaining cleanliness and well-ventilated room kay gika man siya sa lamok. Ang lamok is prone ba na nahugaw, kinahanglan sa mga hugaw-hugaw, kinahanglan siya hinluan kay para kuan siya dapat para mawa tong mosquito. Next is listen activities that requires moderate to high exertion. Fourth is instruct patient to increase oral fluid. Padaghanon siya para ang iyang hilanat maubos. Regulate and maintaining IV patency or as doctor order. Kung kinahanglan kay-order sa doctor na i-regulate iyang IV patency, isihatag dyan sa nurse. May the God bless you. Thank you for listening and keep safe. Once again, this is JB from the Star Bernat, your reporter, saying that mag-ingat tayong lahat.